Hello, my name is Cassandra Prana, and today I will be presenting my persuasive presentation on the Da Vinci surgical system and its growing role in modern healthcare. I will also be introducing the debate around robotic-assisted surgery and what the concerns are surrounding the deterioration of surgical skills. So before I begin, I'd like to quickly outline today's presentation. First, I will talk about the robotic-assisted surgery before going on to what the Da Vinci surgical system is and how it works. Then I will discuss the current developments in the technology before talking about the debate surrounding its impact on surgical skills. And then after presenting the arguments from both sides, I'll explain my position before moving on to the conclusion. So, what is robotic-assisted surgery? It is a form of minimally invasive surgery combining advanced technology with hands-on skill to perform complex procedures. Instead of replacing the surgeon, robotic systems are designed to help the surgeon in operations. Utilizing the small incisions to the patient's body, this accounts to less risks of patient injuries such as bleeding, tissue damage, and helps shorten healing time overall. So today, robotic-assisted surgery is used in other specialties like urology, gynecology, and general surgery as it continues to evolve because of its clinical benefits and also by improving surgical education. So, what is the Da Vinci surgical system? It is one of the most widely used robotic-assisted surgical machines in the world currently. And how it works is that during surgery, the surgeon sits at a console over here and controls the machine with hand movements translated into precise movements of the machine inside the patient's body. And so, regardless how harsh or like how big the movements of the surgeon's hand movements are, it translates into smaller, more precise actions of the machine's hand. The system then gives a high definition of three-dimensional view of the field, right here and then right here. And then also filters out natural hand tremors through the translation of movements and uses endo wrist attachments that mimic a human wrist like this, which creates a greater range of motion and eliminates rigid or awkward motions. It is also important to note that the system still requires someone to sit at the panel throughout the entire procedure, and it also lacks the ability to do anything independently. This way, the robot can assist the surgeon rather than making decisions for them, rather than replacing them in general. Moving on to the current developments, researchers continues to develop new technologies to improve performance in surgery, which also improves robotic-assisted surgery as a result. Current developments would include AI integration to provide decision support, better image, and computer vision, which may further increase precision and also efficiency. Researchers also hope these will make robotic assisted surgery more accessible in healthcare. But despite these points, the surgeon must still be responsible for decision making, with these improvements serving as a tool instead of as a replacement. Sorry. Now that many other robotic assisted surgery has made its way into modern healthcare, a debate has come to surface about its effects on surgical training. Does the increasing use of the Da Vinci surgical system improve surgical training, or does it risk deskilling future surgeons? Some researchers question whether more dependence on robotic technology reduces opportunities for trainees to develop traditional skills and independent decision-making abilities gained through traditional experiences. However, others believe robotic systems actually improve surgical education by providing more opportunities to learn, more opportunities to train, and by being provided objective feedback through the training. So these are the arguments from both sides. Critics say that too much reliance on robotic systems can result to reduction in hands-on experience for surgical trainees and could potentially weaken manual skills and weaken human clinical judgment over time. But in contrast, supporters are arguing that robotic-assisted surgery improves education by providing better visualization, standardized surgical techniques, and objective performance feedback that can help trainees develop technical skills in a structured environment. So the discussion is not technically about how robotic technology should be used, um, but instead how it should be integrated into surgical education while preserving important manual skills. So this is my position, and I think that robotic assisted surgery should complement traditional surgical training. And after considering both perspectives, I believe that the benefits of the Da Vinci surgical system outweighs its potential risks when used responsibly and properly. Robotic assisted surgery offers huge improvements in precision, visualization, and patient care, but it should never replace traditional surgical education. Instead, robotic systems should be to be integrated into training by giving additional learning opportunities while making surgeon while making surgeons continue to develop manual skills, clinical judgment, and the ability to perform procedures on their own without any robotic help. So, in conclusion, the Da Vinci surgical system represents an important advancement in modern surgery by improving precision, visualization, and dexterity during minimally invasive procedures. Although concerns about deskilling need consideration, I believe these risks can be handled with balanced surgical training that combines traditional techniques with robotic assisted technologies. All in all, technology should be seen as a tool that enhances capabilities of skilled surgeons rather than replacing their knowledge and replacing their experiences to provide safe patient care. These are the references that I've taken from to help build my presentation today. And that concludes my presentation. Thank you so much for listening. Please let me know if there's any questions